My name is Dr. Dennis Barley, and I'm here at Barley Wellness in Fairhaven, Massachusetts. Today we're going to talk about sciatica. What is sciatica? Well, sciatica is a gnawing, painful, burning, tingling, which starts in the lower back, goes through the buttocks, down the back of the leg, and all the way into the foot. It is a condition that many people suffer with, and a condition that we see here at Barley Wellness just about daily. The sciatic nerve is made up of 5 spinal nerve roots, 2 from the lower back and 3 from the sacrum, or the lower part of the spine. That nerve, again, that coalesces, comes together, and goes all the way down to the bottom of the foot. The sciatic nerve can actually exit underneath a muscle in the buttocks that goes from the hip to the sacrum. That muscle is called the piriformis, or it can exit through that muscle. And I'll talk a little bit about that in a minute. So what causes sciatica? Well, there are a few things that can cause sciatica. One is something called the subluxation. When a vertebra misaligns, right, and irritates a nerve root. When that happens, and if that nerve root comes down and goes into the buttocks, down into the leg, that is a subluxation, and this is what chiropractors look to correct. So that is one such cause of sciatica. The second cause could actually be a disc bulge or herniation that occurs between the 2 vertebrae. There's this cushion called the disc, and if that bulge of that disc impinges back into the hole where that nerve root comes out, then that could cause an irritation there, and again, helping that person realign that, calm down the swelling on that nerve root and the disc itself, can also help that person with sciatica. And then lastly, the third thing, which I talked about before, is this muscle that goes from here, the sacrum, over to the hip, actually covering the sciatic nerve, and sometimes that sciatic nerve will go through that muscle. If that muscle is tight, it compresses upon that nerve and can cause irritation. Today, what I'm going to demonstrate and go over with you is how we adjust the lower back, so how we correct subluxations. First, we'll diagnose the condition, whether it's a subluxation or misaligned vertebra, a herniation, or the piriformis muscle causing the problem. And we'll show you how to adjust it, what exercises to do, and what therapy to use to decrease that disc bulging. So let's move on to the treatment of sciatica. All right, so Megan is on the Wobble Chair, and basically what we're doing there is trying to improve the disc hydration. So she'll be going back and forth first, okay? And again, taking the disc and moving it back and forth, and then from side to side, and then in a circular motion. Circular one way, circular the other way, and then eventually a figure 8 in an angle. Yeah, so figure 8 out this way and figure 8 that way, okay? It's a little more difficult, but that'll get hydration back into the disc and help with those disc issues that are causing sciatic problems. Megan has sciatic pain down her leg, her right leg. So what we're going to do first is have her lie on her stomach, okay? And we're going to determine where that issue is, okay? And we found that she has an irritation right here in her lower back. So we're going to have her lie facing into the room. On her side, this is called the side posture adjustment, and we're going to adjust the subluxated vertebra that's causing the irritation in her lower back. So, in causing the sciatica. And again, real gently, and that's it. And that's the adjustment. Okay? Now, I'm going to put Megan back on her stomach, and if she is, and she is, if she's an elderly patient, or a patient who has issues with her vertebrae, we can do another technique called the Activator Technique, and we can utilize this little gadget here to make an adjustment simply without a lot of force, which can help her also with sciatic neuritis. And that's the chiropractic adjustment that we do for a patient with sciatica. We adjust the lower back because, again, the 2 nerve roots in the lumbar spine and the 3 sciatic sacral nerve roots coalesce to form the sciatic nerve root. And again, the piriformis muscle that comes here can sometimes tighten and cause pressure on that sciatic nerve root. But adjusting here will help with the musculature and help with the compression on the nerve root there. Thanks a lot.